Good evening. Am I audible?
Yes, we can hear you very well, sir.
All right. Thank you. Um, thank you for the opportunity to impart knowledge. And I also welcome Professor Odunaike. I know it's going to be an interesting discussion. This is one of the rare occasions where you have doctors and lawyers coming together, you know. All right. So medical legal essentials for tomorrow's doctor. Um, So I'll start with the story of Dr. Teju. He was a medical officer who saw a 22-year-old male with clinical features of appendicitis. I mean, it was bread and butter. He examined, made the diagnosis, and took consent for appendicectomy. He went ahead and did the appendicectomy for the patient and discharged the patient. Of course, we would think that everything went well, right? 2 weeks after, he got a legal notice from the patient. Why? That was because the patient said he was not told about the risks of surgery and that he didn't expect a scar that was as big as it was. Am I still audible? Okay.
Yes, you
All
are.
right. Good. Thank you. So he said the scar was bigger than he expected. So who do you think was wrong? Where do you think the problem came from? We'll find out as we go along. At the inception of medicine, doctors were seen as gods. Whatever the doctor said was final, good or bad. I mean, so the doctors were the alpha and the omega, but it has changed. Things have changed. A doctor doesn't have such powers anymore. The patient is the one who has those powers. Of course, we as doctors have rights anyway, but patients are very important now. So, do you believe good doctors get sued? Yes, good doctors get sued. So when you see that a doctor is sued, don't just always look at them and feel like, well, that must be a bad doctor. He doesn't know his job. That's why he got sued. And because of this, medical legal literacy is compulsory for doctors. So we go into the landscape of medical practice, and we know that there's a rise in litigation all around the world, and Nigeria is not left out. Even though the cases of litigation are fewer in Nigeria, but they are on the rise, even in Nigeria and in every other country of the world. And so that's because patients are now aware of their rights. We all know how important social media is. So patients go on social media, they hear things, and they say, "Oh, really? So this was what this doctor did to me. So I shouldn't accept it." All right. You have patients nowadays who will still tell the doctor, "Doctor, don't worry, it's whatever you say. It's whatever you say." That's not true. The patient will turn back in a few days and say, "No, I never knew that was what I meant. The doctor should know better." You know. So when patients say it's whatever you say, just tell the patient, "No, it is whatever you say." Okay. So we are going to go into a few essentials. We are going to kind of make it practical. And we are going to start from informed consent. We've all heard about informed consent, while whether as preclinical or as clinical students or as full-fledged doctors. And that's you telling a patient about a procedure, the risks of the procedure, the benefits of the procedure, the alternatives to the procedure, and possible complications of that procedure. This is very important that you go through all those motions. Many times we make the mistake of thinking that that document that is signed is the key thing. No, that document is almost useless. The document is actually supposed to be like a reminder for the doctor to make him know, oh, have you explained all those things to the patient? It's not supposed to be that once the patient signs that thing, oh, you're all good to go. We make that mistake In theater, the nurses will just say, has consent been signed? Once they see that paper that's been signed, everybody goes to sleep. No. It is more important to document. Documentation of what you had as a discussion with the patient is actually more important. Have you explained everything that I mentioned, the risks, the benefits, and alternatives to the patient? It's not just about signing forms. Now, here we must talk about special cases like minors. You can't see a child of 10 years now and say you took informed consent from a 10-year-old. That would be wrong because it's not at the age where they can make those decisions. So when you have a 10-year-old, of course, they are at an age where you can explain things, but they don't have the legal rights to go ahead with a procedure. And of course, in Nigeria, that's at the age of 18 that anybody can sign. So you don't see someone a girl comes to you, the girl is 16 and says, no, I don't want my parents to know. Let me just sign the paper. In the eyes of the law, you will be found guilty because that is a minor. In the cases of unconscious patients, in cases of emergencies, when the patient cannot give consent, you need to find who the patient has given that responsibility to. So usually we talk about the power of attorney. In many countries, that's legally agreed. But many times is the next of kin usually takes that role, especially in Nigeria. So you must find out who it is, because occasionally it's not the next of kin. So you must know exactly who that person is. That is the person who can sign on behalf of the patient if the patient is incapacitated. So that's about informed consent. Next, we're going to talk about confidentiality. We know that one of the key things in medicine is confidentiality. And that means that you can't just go online and expose the details about any patient. So I'm going to tell you the story of another doctor. This was Dr. Emeka. No, Dr. Emeka was a new, fresh house officer. You know, when you are a house officer, you are very happy now that you are able to touch patients, take samples, you see road traffic accident victims, and then you are able to attend to them immediately. So on this day, he was on call at the emergency department and they brought in an injured patient. He was very happy to attend to the patient, splintered the fractures, cured the, all the ABCs of resuscitation he's been reading all this while. And in the ecstasy, he picked up his phone and took some selfies, showing how bad the injury was. And he put it on his social media accounts. Here comes the great doctor. All right. Patient was fine. Guess what? In 2 days after, he got a notice from the patient's relations, a legal notice. Why did you share the picture of our relation without consent? So confidentiality is very important. So it's important you don't have a right to share patients' pictures. You don't have a right to share their details, except you have informed them and they have given you that consent. So data protection is very, very important. Now we'll talk about documentation. Documentation is your best defense, right? So whatever is not written did not happen. Just to know. So if you write, we usually tell members of staff, if we say this patient should get this amount of fluid and it is not documented that the patient had this amount of fluid, you can assume that the patient did not get that fluid. It's as simple as that. You need to be clear in your documentation, you need to be accurate, and you need to put times to it. I'm going to tell you another story. This was a doctor who saw a 40-year-old man at the emergency department. The man presented with chest pain and difficulty breathing. But after he ordered for an ECG, and he felt that the patient needed to be admitted, The patient said it was not going to be admitted, regardless of what the doctor said, despite the doctor trying to convince the patient. So the patient went home. The following day, the patient died at home. So the relations came in. This is when you see the relations. They came in and they were going to create a scene and sue the doctor, sue the hospital. But it was very simple. The doctor just brought out the documentation. It was clearly written there that he saw the patient at this time, he did this, he did that, and he told the patient to come in for admission. And the patient declined admission. It was clearly documented. Here we talk about forms like a discharge against medical advice form. Those forms, just like I talked about the consent form, those forms are not, they are just to remind you of what you are supposed to do. Because imagine that you just have a sheet of paper where a patient signs. They can say, well, they didn't know what they were signing, but it is your documentation of what you explained to them that is most important. So, of course, the relations left because they knew that the doctor did what was right. We must also note that with electronic medical records, the same thing has to be done. So don't say that because you are documenting on a computer, then you would not document those interactions completely. The next thing I'll talk about is about professional negligence and standard of care. For every patient that you see, there is what we call a reasonable doctor. That means what we expect you as any doctor with the minimum training. Doctor with the minimum training, we expect you to be able to think in a certain way. So once you don't think in that way, then probably you are not fit to be a doctor. Right? So we don't expect a young doctor to know everything, but we expect you to know a few things and not make some mistakes. So once those things are not done, then we can say that doctor is guilty of professional negligence. Now, these are the traps. There are a number of traps that you need to be aware of. One of those is delay. So you are the house officer. You have a patient in the emergency room who came in with diarrhea and vomiting. They called you to see the patient at 9 p.m. and you did not see the patient until 6 a.m. the following day. If anything happens to that patient, they can say you are negligent, because, why will it take you 9 hours to see a patient when you are on call? Okay, if you are ill and you will not be able to do the call, then you should hand over that responsibility. But it is unacceptable for prolonged delays. And of course, anybody is reasonable. For example, if they say you saw the patient within an hour of presentation and the patient died, everybody would think, oh, when did you see the patient? I saw within an hour. Nobody is going to blame you now. You'll say, okay, well, that's reasonable. That's reasonable. All right. The next thing is missed diagnosis. Like I said, for a doctor, that's why you've gone to medical school. There are some diagnoses that you shouldn't miss. So you see a patient who has peritonitis, right, from a gastric perforation, and you are treating the patient for peptic ulcer with just omeprazole, and the patient is going in and out. Those kinds of misdiagnoses are not acceptable. And if the patient chooses the legal route, you might not escape. The next thing I'll talk about is medication errors. So it happened in the UK, I think about 2 years ago, when a senior doctor was suspended. And what was his mistake? He saw the thyroid function tests of a patient. And of course, we always give you this thyroid function test to examine as medical students. So, it shouldn't be very difficult. It shouldn't be difficult. And that was a senior doctor, not a fresh doctor. So he saw the thyroid function test, and the patient had hyperthyroidism. Okay, you know what hyperthyroidism is. Now, he misinterpreted the result as hypothyroidism. And you know that the drugs that are going to be given are going to be the complete opposite. So he was giving the patient levothyroxine when the patient was already hyperthyroid. So a patient's thyroid hormone levels are already too high, and you should give the patient a drug to reduce it. And you are now giving a drug that was further increasing it. Of course, it was a mistake because in his documentation, he wrote hypothyroidism, meaning that he just misinterpreted that thyroid function report. But he was suspended because that was not acceptable. The next thing we'll talk about is duty of care and boundaries. So, doctors are not allowed to be in romantic relationships with their patients. So, you don't see a patient. Of course, generally, if you're a good doctor, patients will probably like you. Then they begin to give you gifts. That's fine. That's fine. You take the gifts. But once it comes to the patient visiting you every time, can we go out? There might be a problem there. According to the law, you are not supposed to be in a romantic relationship with your patients. And that's simply because it may cloud your judgments. When you're supposed to do something, you probably not do what you're supposed to do. Next thing we're going to talk about is about reporting obligations. So there are situations where a doctor is mandated to report. If there's a case of child abuse, patients with child abuse you discover during your consultation that the child is being abused. You don't just keep the information to yourself and feel, well, that's their business. No. If anything happens to that child and they check the documentation, you will be found liable. Right? Cases of infectious diseases. So you see a patient, we're talking about Ebola. A patient comes to your facility and you are suspecting Ebola and you feel, well, maybe the patient speaks to you and say, doctor, please, I don't want anybody to know. Then you take the patient into a private room and you are taking care of the patient. You will be found liable because you must report such kinds of things. Gunshot injuries must be reported. You don't see a patient who has a gunshot injury and then you keep in your hospital and feel, well, the patient tells you that don't worry, I just don't want government to be aware. You must report. So those are key things that you must take note. Effective communication is actually a shield for the doctor. And it means that even though the good doctors get sued, doctors who communicate properly many times may be shielded to some extent. Because if you have a good line of communication with the patient, you have a good line of rapport with the patient, you probably have passed across all that information to the patient in a way that they understand. And it has even happened many times that a patient wants to sue and they select members of the team to sue. For example, you have a team of 5 doctors. You have the consultants and you have the younger doctors. And you have situations where the patient picks the people he wants to include in the lawsuit because the patient likes some of the members of that team. And why do they get to like them? It's simply because you have communicated properly with the patient. Teamwork and systems are important. If you're working in an organization where there's already a system, systems prevent errors. You already know that once a patient comes in, the nurse does this, the counselor does this, so in that kind of system, you probably make less mistakes. But if you're in a system where you are one and only, you are at risk. So you must be more careful. You must make sure that whenever decision making is to be taken, whether in theaters, wherever, it must be ethical. It must be ethical. Let's talk about a few other practical things. How do you handle an angry patient or their relation? So someone is shouting at you. The way forward is not for you to start shouting at the person. We always say that if you watch the way patients behave to their family doctors, and you compare it with the way they behave when they come to bigger institutions, maybe a patient comes to Babcock, and the way they are going to be behaving, compared to what they will do when they are in their small private hospital. It's simply because they see that doctor in their private hospital as a friend. So when they come to you in these big hospitals to learn to be able to manage them, a shouting patient should not be handled by a shouting doctor. When the patient is angry, that is the time when the doctor needs to calm down. Now, how do you respond if you receive a medical legal notice? Uh, law specialist is going to deal with that. So I'm going to skip that for now. You should also be aware that doctors are meant to be insured. You're supposed to know what you have as your institutional support. Is it that in your institution you are on your own? So standard institutions usually will have a legal team, they will have a lawyer, they will have people that will advise you, even if you get into situations that are quite difficult. What are the future trends of this topic? Artificial intelligence and telemedicine. You don't see a patient, you then type all the symptoms of the patient into your AI, into ChatGPT, and look for the diagnosis there. And something happens, you say you asked ChatGPT, that was what ChatGPT told you was the diagnosis. So modern doctors, you won't depend on ChatGPT. Don't depend on AI for everything you're going. AI is supposed to support you. It shouldn't be the basis of everything you are doing. It means that the study of medicine itself is so important and nothing can substitute it. Online consultations are as important. So the fact that one, if you are speaking to a patient on the phone or you are speaking to the patient in on Google Meet, the same responsibility that you have in terms of duty of care to that patient, if you are seeing them in your physical consultation room, it's the same duty of care you have to that patient, which is why you need to be careful. As a matter of fact, young doctors should avoid phone and online consultations because they can easily put you in trouble. You are not experienced enough. You don't know. Sometimes patients don't give you the full story. And then you then tell the patient to go and buy medications based on what you are hearing on the phone. The patient that you don't know, that can land the patient in trouble. Nowadays, you have doctors as advocates. And what is worse than having a doctor as the advocate of the patient? Meaning that the doctor already knows where the loopholes are. He already knows that, no, this doctor should not have done this. So when that doctor is advocating for a patient, you can be sure that if you have left a lot of, if you have left many things undone, that may be a problem. So in conclusion, it's not about paranoia. It's not about being afraid. You have doctors running around, say, "Oh, I don't want this patient to sue me. I don't want them to sue me." It's not about that. It's about empowerment. It's about you knowing the right things to do. Once you do the right things, not just about being afraid that someone is going to sue you, you will likely not be sued. And if you happen to be sued, most likely you would probably win such cases in court. So a good doctor heals with their hands, but the better doctor has the knowledge to protect him or herself. So I believe that as doctors, young doctors, older doctors, we should be armed with everything that is required for us to navigate these medical legal aspects of medicine. We'll take questions much later as required. Thank you very much.